Well, Ghana has reimposed a ban on social gatherings as the number of COVID-19 cases there climb. President Nana Akufo-Addo said there is a need to reactivate isolation centers as hospitals have become full. AFP correspondent in Ghana, Kent Mensah, joins us now to give us more details. Kent, good to have you tonight. How bad is the situation in terms of a rise in infections, hospital admissions, but also a number of those who are succumbing to the virus?
Well, good evening. Nice joining you from Accra, Ghana. Well, it's as bad as you can think of because a few weeks back, we were recording around 200 plus or less cases in a day. But at the moment, we are recording 700 plus new cases of COVID-19 on a daily basis, which is putting a lot of pressure on the health services, the hospital facilities, the ambulances, and even the health officials. So currently, as we speak, we are talking about 67,000 plus confirmed cases in the country, and then 416 deaths. A few days back, we were talking about 390 deaths, but just today, it's been confirmed that 30 more people are dead, and then raising the number or the death toll to 416. Currently, the active cases in the country is around 5,000 when we had close to about 300, 500 a few weeks ago. So it should tell you that the situation is looking so dire. A lot must be done, else we are heading into a very difficult situation with our health system.
Justifying these restrictions, President Akufo-Addo said our hospitals have become full and we have had to reactivate our isolation centers. How is the health system holding up and how far is it from complete collapse?
Well, we are talking about a situation where there is so much pressure on health officials, and then at the same time, a lot of the health officials at the same time are contracting the disease. So that should tell you that health officials themselves are having to deal with how to stop the spread of the virus among themselves. And at the same time, we are having a situation where a lot of citizens are reporting to health facilities with the virus as well. So we find ourselves in a huge dilemma because whereas the isolation centers are being reactivated so that we can accommodate most of the diseases, some of the private facilities are also turning their consulting room into COVID-19 treatment centers. So it's kind of a lot of things are happening at the same time, unlike a few months back when we thought that the situation was under control, all because we let our guards down. Everybody thought the disease was practically over or it no longer exists in Ghana, so we should do business as usual. But coming from an election, coming from a Christmas festivity, a lot of holiday makers coming into the country, and also a lot of merrymaking, weddings, and also social gatherings, it tells you that we all threw away most of these safety protocols off the guard. And then we find ourselves in a very dire situation at the moment. And the president or the government is torn between having to save an economy which is already dying and also human beings who are dying. So the president finds himself in a very difficult situation. So to start with, instead of going for an outright partial lockdown, he decided to probably restrict some of our movement in phases. So first of all, we need to start with social gatherings, and then also some of these large gatherings at public places, just to see that maybe in the next few days or weeks, if the numbers could come down. Other than that, we are going to find ourselves to force a lockdown on this country, and that will be a very difficult moment for the economy to deal with.
Now, how far along the process is the Ghanaian government in acquiring vaccines?
Well, in the president's address to the nation yesterday, he mentioned that at least the first vaccines are expected in the country by March of this year, but that would be a limited number. But when we are talking about 17.6 million vaccines doses for the country, maybe around June of this year. So the first vaccine, which is limited, will probably take care of the health workers, frontline health workers, the elderly, and then a few essential workers. But we are going to talk about the larger population probably around June thereabouts.
All right. As far as the population itself and vaccine hesitancy, how are the people in Ghana receiving news of a vaccination?
The question again, I think I lost you.
How hesitant are the people in Ghana in taking the vaccine? I mean, are they welcoming to the inoculation program?
Well, I think we have a divided nation. We have a school of thought who think that the vaccine is not really working in some countries. So people are quite in a dilemma as to whether to accept it or otherwise when it comes to the country. Whereas others are also saying that once the Food and Drugs Authority or the health officials in the country certify and approve that whatever vaccine is being brought in the country has been given the green light,